Well, good morning, everyone. It is now the top of the hour, so we can begin. My name is David Brown, and I will be your instructor on From Problem to Prevention, evidence-based public health. I am an engagement specialist for Region 4, and I specifically work with the states of North Dakota, South Dakota, and Wyoming. So before we start, you may want to locate the open chat box. It is closed by default. Look in the chat bubble if you can find it. We're going to provide a link to an evaluation at the end of the session. Completing the evaluation is the first step to claiming your MLA, CE, or Certified Health Education Specialist credit. At the end, there will be a link that we'll put in the chat box so that you can get it. We do have live captioning available today. You can find it in the multimedia box located near the chat box. You may need to scroll down in the box to link and click the link to start the live stream. And we are also recording today's session. It takes approximately 30 days to edit and caption the video. We will send a link to the recording to all registrations when it's available. I am also joined today by Molly, who is going to be my technical advisor here from the National Training Office. And again, we will get started here. So to start off, you may be a first-time attendee at an NLM webinar. Just want to basically introduce who we are, what our organization stands for, what we try to do here. Network of the National Library of Medicine, also known as NNLM, which is within the national. It's a subsidiary of the National Library of Medicine, and it's housed within the National Institutes of Health, based out of Bethesda, Maryland. We are the education and outreach arm of the National Library of Medicine. We work regionally, getting to know communities on the ground and helping the communities serve the people they know best. So again, I'm based in Region 4, which is this big, huge glob of states. Each one of you comes from a different region depending on your states. Again, mostly moving from east to west, and then with a few things in between going back. So again, we are present across the country, and we work to advance the health and well-being of everyone through access and understanding how to use health information. We work with organizations like libraries, schools, healthcare workers, public health organizations, and the like. So again, we are a outreach and engagement arm that really wants to get health information to people as best we can. We do it through providing funding to organizations. We also offer other forms of outreach and engagement, such as attending conferences, doing these classes, offering also, besides these live webinars, we have on-demand classes and traditional Moodle asynchronous classes that are offered. And again, we offer all these things to you free of charge because we are federally funded. All of our programs have to be readily accessible and usable by the communities that we serve and the public at will. So we will move on here. So what are we trying to accomplish today? We got 4 learning objectives. The first is to describe the 3 domains of influence. The second is to list the 7 steps involved in evidence-based public health framework. We're going to use the PICO framework to develop a research question, and then we're going to apply search filters to find high-quality researchers from at least 2 online sources. So again, a lot to cover, going to be a lot to do in an hour, but we'll make it as we go along. So to get us started here, we're going to have a little question here. You can type in the chat here. What is public health to you? So again, if you want to type it in, it would be helpful. We can definitely talk about it. We'll see what we got. Okay, one person says preventative medicine. Doctor of the community. Okay. Well-being of a community, improving health in the community's systematic education, protecting communities' well-being. So again, a lot of community health, wellness, and prevention. Okay, a lot of different ideas here. Safety, community health comes in there. The protection of the community, understanding where we are and what we're trying to do. So again, a lot of good things here. I'll give you a formal definition next. And again, there's not necessarily one correct definition, but we're going to use the EBPH definition here, which is public health promotes and protects the health of people and the communities where they live, learn, work, and play. It's quite a grandiose definition because it's all encompassing. But again, it's really, to me, it looks at how do we make sure people are able to ascertain the best health outcomes and health quality of life they can with what they have and the resources they have, from my perspective. But again, and that's their definition. And again, all of you basically hit on that global approach as we go forward here. So what are the 10 great public health achievements in the 21st century? Now, this again comes from the Centers for Disease Control and Prevention. Again, opinion, not necessarily everything, but again, great ideas here of really looking at, immunizations, control of infectious diseases, declines in heart. Again, these have been really great impacts that we've seen. And again, I think there'll be more as we go on. And I think there's also ways to grow in these achievements that we look at. And again, all of these things have basically added to probably 25 years of the life expectancy of the people in the United States over the span of the last century. So again, we're making progress, we're looking at it, but again, there's still room to grow, and we're still going to look at it as we move forward. So the other thing we have to look at is, life expectancy is one of those things, and health disparities are numerous in our society right now. And what's interesting here is we're going to show an example here of West St. Paul, Minnesota, one address in West St. Paul, Minnesota, second address in West St. Paul, Minnesota, within a 1.7 mile difference, and even in the same zip code, that you can see just the difference in life expectancy because of disparities, locations, what's going on there. And, these are created with the Robert Wood Johnson Foundation tool called What Makes a Life Long. You can look at your own zip code off this thing. And again, it's basically what we're looking at, looking at these things. These are issues that we see that, life expectancy can be maybe manipulate a little bit, but it does show that disparities do exist, and they do have a major impact on individuals and others in the world. So what causes health inequity? There are two really big areas we look at. There's the structural inequities, and there's the social determinants of health. The structural inequities we aren't going to necessarily be able to change overnight or make big inroads with, because that's, systematic disadvantage of one social group compared to another group. The other groups from whom they exist: racism, sexism, classism, ableism, xenophobia, homophobia, etc. Those are things that are going to be a lot harder to change and a lot more not changeable. Whereas the social determinants of health, we have a little bit more that we individually can do and as communities can do to make changes in. And that for that reason, that's why public health interventions tend to focus more on the social determinants of health more than the structural determinants of health. And again, these are the conditions in the environment in which people live, learn, work, play, worship, and age that affect a wide range of health, now functioning and quality of life outcomes and risk. And again, these are the ones we like to focus on. This is what we do. So basically, knowing this, we like to focus our interventions, our ideas, getting to that approach of really looking at the social determinants, moving forward as we go. And again, is we can take action using evidence-based public health, considering we consider those structural inequities, but really focusing on the social determinants to really make inroads and to move forward as we go. And again, the big thing that we're looking at in public health anymore is that they're evidence-based intervention, that there's research and ideas that support the programs that we are going to be using, implementing, and working across as we go forward. So what is evidence-based public health? The standard definition that we like to use is the development, implementation, and evaluation of effective programs and policies in public health through application of principles of scientific reasoning. And again, the real outcome is the development, we want to really look at what effective programs and policies are. There's a key aspect of evidence-based public health, but how do you know something is an effective program or policy? It doesn't always provide a good framework, because like I say, what may work in one community may not work in another. And for that reason, that's why we like to go to the published literature, find the resources that are available, and really use them to enhance and make our things work. So again, looking at where are we going, what are we doing, how are we going to do this, and how is it going to work in our communities that we want to work with it. And again, we always want to look at multiple domains. but we don't want to neglect the why, as we say. This could be useful, not all right. That there are, and again, you can always go to Healthy People 2020 or 2030 now. And it's 2030, to really look at where we're going, what's going on, at least in the social determinants of health, and where we're trying to go as we go along here in these ideas. So really, it's really looking at where is the evidence coming from, who's writing it, where has it come? And again, there are always going to be questions with evidence: is how vetted was the research? Is AI being used? Is AI not being used? There's a lot of questions that can come with this, but we can definitely explore it, and we'll move on from there as we continue. So why is it important? We can access more higher quality information on what works. Again, reason we have evidence is it shows what's working, or what has worked historically, or what isn't working, because that's the thing, is just because something is working now doesn't mean it will not, or if it is working, it will continue to work. These are things to look at as we work across and look across those things. There's a higher likelihood of successful programming and policies being implemented. And that's really the idea here, is that we're looking at what a successful program is. What's making that program work? Is it because they have community health workers that speak the language and are members of the community? Or is it because the material is written at a 9th grade reading level? So what's making it work? What's not making it work? It increases our workforce productivity, because again, we're not going to waste our time on using things that that we have documentation that are not working in that community for whatever reason. Now, again, there's nothing wrong with retrying, but again, time and money are scarce. And when we are doing these type of projects, we need to know which ones are truly working, truly using it, and working appropriately, and an efficient use of the public and private resources. Because again, if you're work for a state or a federal agency, they're going to say look for accountability. They're going to say, how is this money being used? How is it making an impact? So that we know that we can continue to fund you or to keep you moving forward. One program I do like to bring up is, the DARE program, which is the drug education thing that's provided by many police stations and police offices around the country. It costs about $750 million on an annual basis to implement the program, but there have been multiple studies and systematic reviews have been conducted and found that the DARE program has either no or negligible impact on preventing substance abuse among children and adolescents. So if you are thinking about a substance abuse prevention program, DARE may not be the best intervention for getting the results you want. It also lacks cost effectiveness, and if you go through an evidence-based public health framework to research it before deciding to implement it, you would uncover that. And that's what we're really saying. It's just because there's a good program out there, or a program that's getting a lot of attention, doesn't mean it's going to be the best for your situation, for your community, or even what the evidence is showing nationwide or worldwide. So again, there are articles available on this, and you can definitely move forward as you want to look at these things. So next thing we like to talk about here is Public Health Accreditation Board. This is where if you are a public health department and you are trying to get accredited, or you are trying to get the standards that meet the standards of accreditation from this Public Health Accreditation Board, one of their domains is Domain 9, and it is to improve and innovate public health functions through ongoing evaluation, research, and continuous quality improvements. And substandard 2 is to use and contribute to developing research, evidence, practice-based insights, and other forms of information for decision-making. So again, really it is part of these things moving forward that health departments see the value in it. We want to make sure that we are using the right evidence, getting it, making sure it's grounded in the literature, grounded in the theoretical foundations to move forward and work for us as we go along. So now we're getting to the meat and potatoes of this presentation. We're really going to start talking about what are our domains of influence. The first is the community needs, the politics, and the economics. So again, this is where our community needs assessment comes in. What does the community need? What are the politics in the community? What are the economic status? Can we do things? Can we not do things because we have resources? We don't have resources. Figuring out, understanding what's there. Then on the other side, we have our experience, knowledge, and expertise, which is who knows what, who do we have that's available, what knowledge is there, what community knowledge is there, what are the expertise that we look at. And then based upon that, we pull those together, we find the best available research and evidence. And in this case, it's, what's available. Not everything is going to be available. There might be things that are under wraps that we can't get access to, that we don't have as we go forward. But these three areas really become our decisions for public health practice. We develop, implement, an evaluation of our interventions, our programs, and our policies to be sure that they are making an impact on public health. Now, maybe not all of them are going to be positive impacts, and that's okay. We can always reassess, look, move back, and reassess as we go along. But again, the idea here is to really move forward, look at things, assess it, say, hey, this is what the best data is, this is the best resources we have, and these are the ways we can work and look as we go along. So a lot of ideas there. This is sort of the 10,000 feet area. This is sort of the way we do it now. So our process, again, step one, I always like to say, is we do a community assessment. What's going on in our community? So we go out and understand what is actually happening. Assessing the needs for resources, interventions, and overall health needs. So what are people wanting to see? How are we going to look at it? Where are we going to go forward? And how are we going to go about doing that? Then we have to quantify it. So once we know what the people say they want or they desire, we have to, quantify it. So we're going to go out and identify the sources of existing data related to the issue or problem. So just because somebody says it doesn't mean that the data is going to support it. And sometimes there's a lag in that, and that's okay. But again, you as doing that community needs assessment are also creating that data for your communities as you go forward. You develop a concise statement of the issue. So again, there's a lot of times people are saying these are issues, but we don't always get it down to a real concise statement. The key components of the issue statement include the health condition or risk factor that are being the population's affected, the size and scope of the problem, prevention opportunities, and potential stakeholders. And this is really getting down to your sort of research questions if you're doing these things. Then you determine what is known through the scientific literature. And that's really what we're going to focus on in this class today, but we will go there a little bit more detail as forward. Then we develop and prioritize the program and the policy outcomes. Okay, so now we've got all of our data, we're coming forward, and then we say, what can we do? How much money do we have? How much time do we have to do this? And how can we get it done in that idea? Really using our strategic planning, our strategic thought processes to ensure that we are getting the outcomes that we can accomplish with the resources and time we have. Then we develop an action plan and implementation interventions. So again, we say, this is how it's going to be done. We're going to do it. We're going to get buy-in from people. We're going to really start implementing the program and seeing how it's going to work. And then the last part, which is always important, is we have to evaluate it to say, hey, did it work? Did it not work? What's working? What's not working? Whether we're doing a process evaluation, impact, or outcome evaluation throughout these ideas as we go forward, as we look at it. So like I say, it is what we do here. So again, as I said before, we're going to focus on step 4 here and determining what is known throughout the scientific literature. Specifically, we're going to look at developing a research question that will return usable and relevant results and introduce you to some resources that can help you find literature and judge the quality of your results. Before we go on, do we have any questions or comments at this point? Because this is sort of where we are going. Wait for a minute.
We do not have any questions at the moment.
Okay.
But
very good.
Feel free to share them in the chat if you do.
Yes, and I do like to stop and give you breaks in between here before we go into the more digging deeper here. All right, so the framework we typically use with evidence-based public health or medical research or anything is a PICO. And this is basically just an acronym that stands for the P is you're going to be your patient, your population, and your problem. Doesn't have to be mutually exclusive, but sometimes you're going to do a specific patient if you're doing a single case study, or you're going to look at a population or a problem. Then your I is your intervention. What are you going to do? How are we going to look at it? What do we know that's been done? What type of intervention are we going to look at? Are we going to look at screening? Are we going to look at interventions or treatment? What are we going to do? Then we can do a comparison or a control. We don't have to do that, but it is part of this process that we look at. And then we look at outcomes. So, as we look at it, and then sometimes we put in a time frame, again, which can be for current things, or we can do it retrospectively, looking at historical events as well. So, looking at other outbreak, if we want to talk about COVID, looking at how the Spanish flu may have been similar or different to COVID. So we can look at Spanish flu in a certain time frame versus the researches that are being done in COVID currently. Just different ways to look at it and use it. So it's a very straightforward. You do necessarily have to do it. A lot of places just do PIO type questions, which is a problem, an intervention, and an outcome. They just want to know what's getting it. That's usually much more of the focus of a scoping review. We'll talk more about these terms as we go along here going forward. So one example here is, does a school-based vaccination education campaign for parents increase the rate of vaccination among elementary school children compared to students whose parents did not receive the educational campaign? So again, in this thing, we're basically starting, with the intervention is that school-based vaccination education campaign. That's what it is for parents. The outcome is we're looking at increasing the rate of vaccination among elementary school children. Comparison is already defined for us compared to students whose parents did not receive the educational campaign. So, I mean, it's all in the detail. As we look at it. I mean, again, and you can also just look at it too. You may only want to look at educational campaigns. You may only want to look at specific vaccinations too, because again, depending on what research you're getting, results you're getting, you may want to refine to ensure you're getting the results you want. I mean, this is a very large question. It's not necessarily focused, but it is enough to get you started and look at it from a policy, larger, more grand scale, which maybe some policymakers or others would be more interested in than just specific vaccines and vaccinations that could be used as we go on. Okay. So again, we're breaking it out again. The elementary school children is our population. The intervention is the educational campaign. The comparison is no educational campaign. And the outcomes are vaccination rate. Or another way we can build it, does, our I influence the O and the P of the C. So in this case, it will be, does the educational campaign influence vaccination rate in elementary school children compared to no educational campaign? Just a way of structuring your questions, looking at it, working across it, and getting where you need to go as you look at it. All right. So another scenario we can look at is our local community has seen a decrease in cancer screenings in multilingual refugee and immigrant communities. You would like to create a community health worker program to increase the rates of regular cancer screenings in these communities. No programs currently exist in your community, so you need to find evidence that putting effort into the program will increase the rates of cancer screening. And I'll even go further so that you can get funded by your local health department, because they're not going to fund something that they just think is a problem. You also need to justify it, look at it, work at it, and say that this is a problem and here is why. What do you think are the elements of the PICO question here? So you can just type P and I C O as you see it. So what would you see are these pieces of this question? If you don't know, that's okay. I mean, we're just trying to reinforce here, but I'll give you a minute here to think about it. Outcome could be cancer screenings. Yeah, that could also be, okay, your population's multilingual, community health workers, your intervention. Yeah, that's pretty good. Yeah, you guys are on the right track here. So we'll break it down a little bit further here. You guys are doing good here. So we'll break it down. Good. So the problem is, like I say, is our decrease in rates of cancer screening in multilingual refugees and immigrant communities. Our intervention is our community health worker program. Our comparison is there's no program that exists. Again, you don't necessarily have to say that because nothing means nothing, at least in my world. And outcomes are the increased rates of cancer screening in multilingual communities. We want to see an increase in those screenings. So yes, it works out that way. And then way we can really structure this question further is, will a community health worker program increase the rate of preventative cancer screenings in multilingual refugees and immigrant communities? So again, this is a PIO, but done in an IOP fashion. Doesn't matter as long as the components are there, you can find it. It doesn't always have to be so perfect that it fits in those ideas, but it definitely looks as you put it together. So it's and we can also have flexibility in how we word things, because again, it doesn't have to be worded exactly this way, and words do matter, especially when we're searching in databases and other things, but we'll get into that as we get into some of our demonstrations. So as we said before, the comparison really wasn't doing anything, so we removed it, right? So it doesn't have to be there. Then, now that we have this question, we can begin to find the research and find what else. I guess my first questions to you all here is, if this was a research question, how would you start searching? What would you do? How would you go about trying to find this? And if you don't know, that's okay. I mean, I'm just here to see where you are. You could Google. That's always that's always a good start. I mean, you can always go to Google. That's always a good one. Yeah, you can go to PubMed. I appreciate that. Yay. Yeah, you're talking about some of our products. We will go over that. You can do some Boolean logic there. You can break it into keywords. I would even say we could even go further and use some medical subject headings, which again is another class that you can do. Repeat the question. How would you start searching if this was a research question for you? What would you do? How would you set this up? How would you say, hey, this is the question I need to find. How am I going to find the information? PubMed use keywords. All right, we can do that. Okay, I think you guys have some ideas here. We will give you some more tools that may be a little bit more specific and a little better as you go forward. That's the second part of this class where we actually get to play a little more. And then you've talked about some databases, search engines you may use. And like I say, there's no one way or right or wrong way to do this. It's just a way of thinking. It's processing. It's a way of looking at it and making it possible for you as we look at it. So if we start doing this type of searches, local churches, yes, you can use community-based organizations, faith-based organizations. There's lots of places you can go. CDC, NIH, EBSCO, Medline, Plus. I mean, there's lots of stuff that we can look at. So now I talked about that term of what is high quality research, right? So technically there is a pyramid that's called the hierarchy of evidence, and it goes from the most highest quality to the least quality. And again, it's where it is. So the lowest level that we look at is anecdotal, which is things people say, and that are out there that, we don't necessarily have anything other than the anecdotes that tell us that it is. Then we have ideas, expert opinions, and editorials, which are good, but they haven't necessarily been vetted. It's just, that's my opinion. That's what David says is the right answer. Doesn't necessarily make it right. It's just the way it is based on it. Then we have case studies, which are great because they're a single case or a few cases. Problem is that's not necessarily representative of a whole community, a whole world, or a whole idea. So again, we have to go beyond those case studies usually to look at it. Then we can have some cross-sectional surveys, which are nice because we're getting cross-sections of our population. The problem is with the cross-section is there's not necessarily randomized. It's not necessarily looked at beyond that, and it's usually a sample of convenience. And samples of convenience work Again, most all research done in graduate school is cross-sectional surveys because of time, money, and resources. Then we can do some case control studies, which are great if we can get to that level where we look at what the case is. Can we control it? Can we make it comparative to another group? Putting some refinements on it, making it more. But still, remember, that's only one single case. A cohort study is great because, again, you're looking at one group of people that are together for, 10, 15, 20 years, and it's doing it. But again, at the same time, that's just one place, one location, one area to look at it. Sort of the gold standard that we're getting to is these randomized clinical trials, which is, again, sort of the gold standard in medicine, where you have a group that gets the intervention, a group that doesn't. They have equal chance of getting into those different groups, and it's really controlled. Problem is, it costs a lot of money and it takes a lot of time to have a quality randomized control trial for your ideas. But if you can find those, they are the best source of research. And then the last one are the systematic reviews and meta-analysis, which are the strongest thing, because that's basically everybody went in there and grabbed all the studies, all the research that's there, and now have compiled a thing saying this is what it says based on the results of 23 systematic randomized clinical trials or cohort studies that have been out there. Again, and it really does show your ideas as you go forward. And you got to realize not all this stuff is going to be available in the top levels, but we can hope there are. A lot more public health is focusing on systematic review and meta-analysis now, where it really is trying to pull all of the resources from different places and research that is available to make better informed, evidence-informed decisions, evidence-based guidelines, and evidence-based approaches to where we're going. Once we look at this, we really do start to see where we're going and making it go forward. So these are just different ways that we look and move as we go along. So now we're getting to the fun part where we're going to spend a little time demonstrating 3 of our tools. The first is going to be PubMed. The second is the community guide. And third is health evidence. I am going to stop sharing so I can share my web browser for you all to see here. So let me get over there, over here, and over this way, that there, this here. 1 second, everyone. I'm just trying to clean up everything so that we have it. There we go. All right. And then I am going to share this one. Hopefully everybody sees PubMed out there in the world. So if we're going to use that same idea of immigrant cancer screening community health workers, I'm just going to type in these 3 terms into PubMed. I pre-populated the search here, but I could have just easily typed it in or copied it as we go forward. As we go along here. So if we do this search, we are going to find 51 results. And I don't know why I don't have, I didn't get what I wanted on the side here. Oh, there it is. When in doubt, expand it. All right. So we got 51 results here, which is good. It's not too much. But what I'm really going to say here, but we're now going to sort of break it down further. So usually what we're wanting to find, again, if you don't have a lot of resources as we go along, sorry. Take out the commas. I didn't realize I had commas. Sorry. Still 51. It didn't change. So that's all right. As we see here. So as we look at it, we can definitely look at it from that. Now, again, a lot of times we're going to want to make sure that we have the appropriate thing. So in this case, since we're looking at the highest levels here that we're wanting to use, we probably will want to, I won't do it that fancy, a systematic review, a randomized clinical controlled trial, and a meta-analysis. And again, you can always do these as you do forward. And when we do that, we get down to 6 results. So this is really good. Some of them are free PMC articles, and we'll talk a little bit what that means in a minute here. But we have 6 articles here that we can definitely use on that. And again, very useful. So if we want to say, for example, this one on cervical cancer screening. So we can select it. It's going to give us barriers to cervical cancer screening faced by immigrant Muslim women, a systematic scoping review. Well, that sounds like it's going to be the highest level. It was published quite recently in 2023. It was peer reviewed as we look at it. So here's just the abstract and a couple of things. Also provides us some similar articles. We really want to get the article specifically. We go to this free full text from PMC, and I will always recommend PMC because that is PubMed Central, and we know we have access to it, and we're not going to necessarily run into a hidden paywall or something else as it goes along. You hear on the left, you're going to have the full article that we look at here. That's available. You can also download the PDF here as well. We'll download it. You can print it. You can save it. You have it as you look at it going forward. And like I say, the nice thing about these types of systematic reviews is they tell you where they got these things, what it was. It goes through this whole process. It really looks at it and sort of gives you an idea of what research has been done in this area and what part of the world it is. Again, as you see, not a ton of things in the United States, but there are several. So again, depending on what you're looking at, what you want to look at for age groups. I mean, again, they really do break it down. It showcases a lot, and it really does give you some themes to look at. And it gives you an idea of how to structure it and maybe answer your question or give you evidence to say, hey, this is what's being done other places and it seems to work or it doesn't seem to work. Maybe we need to try something new as we go along. So that is in many respects what PubMed does. You can, like I say, you can further do different things if you want to limit it to the last 10 years, which is an option which you can get down to 4 results. If you want to also, make sure that it is full text available, you probably get down to 4 again. And again, can do further refinement depending on what you're getting as you look at your results. So that is one way of doing a great little search here. We can further limit, we can do different things. I always recommend you to use PubMed Central for your results because we know we can get those articles easily. The other thing to potentially also look at here, we look at these things are our medical subject headings. Here, keywords. See, these are keywords, may or may not be a medical subject heading, but again, definitely things to consider as you look at it. Some journals are indexed, have keywords mapped to medical subject. Some don't. It just depends on the specific journal. But again, these were the keywords they used, and you may want to go back and look at these using them for other searches if you're trying to expand because you don't have enough evidence to support your ideas. So that is what I can say on the PubMed search. The second resource we use here is health evidence. And this is again from McMaster University School of Nursing. It's a good little tool here. What's nice here is they have an advanced search feature, which we will go to. And what I'm going to do this time, I'm not going to look at this. Look at as we go forward. And before I go on, were there any questions on PubMed? I think hopefully you've been familiar with it and looked at it before.
No questions on PubMed, but
Okay.
do share questions in chat if you have them.
Yes, please do. Please do. So the second one here is, like I say, is our health evidence idea. So what's nice here is they have a lot of drop-down menus. And because we're doing something different, we're gonna just do it this way. So we're gonna go with chronic disease cancer because we were talking about cancer screening, right? And that will be one of our ideas. We're gonna leave the population field bump because I'm gonna pull it up here. You're not gonna see refugees or migrants as a selection, at least in this with them. But I mean, there are ways of doing it. You can definitely do that. we will use our intervention strategies here as behavior modification. Sure I'm on the right track here. We're going to do behavior modification, education awareness, and maybe some policy and legislation. No, we'll leave that out. As we go along. So again, we'll just use those two as our ideas here, and we will just see what we get here. Now, again, we get 270 results, which is quite high, I find, as we go along. So what we can do here is go back and we can modify this a little bit by just going back. And we're going to actually type in a key term here that we will use, and we will use our term, I think we'll use community health worker to get when we do this. And when we do that, you see we get down to 7 results, and which is very easy, very direct, very straight. Now, what's nice about this is it does have these little green boxes here that we look at. So if we look at it here, this is one that what the cost was. So if you're looking at what it's going to cost, it's good. What else I like here is there's a rating scale based on that. You know, the higher it is means the more quality it is, the lower it is, the less likely it is. Again, it also gives warnings here that, you know, was published over 10 years ago. This is one that's very highly accessed. Again, there's also summaries down here of what they mean. But again, those are nice things. But like I say, in this case, what we can do is we can look at this. Who provides this is going to be from McMaster, but it's also going to be based on that hierarchy of evidence of what it is. And you see here, you have this view, this quality assessment, and they talk about why it is, in their case, an 8. It says, you know, is the research question clearly focused? Are appropriate criteria used as you look at it? So again, it explains why they gave the score they did. And that's sort of the summary. And you can also get a complete quality assessment here and why. So it goes further on and assesses it as you go along. So, and then again, you have the article here. It explains it. It gives you ideas here as you look at it. And again, what's nice here is it links back out to PubMed. Click it, you'll get your PubMed. Again, we have a free PMC article. You can download it, we can read it, we can get it. So it's a very nice way of finding our resources, using resources, and looking at it. So again, it's another way of doing some searches. It is a easier way to do it. I mean, it's a way of putting your PICO question in there. I mean, and like I say, this only, one thing is it only goes back to 1995 to 2024. So again, if you're looking at a historical perspective, you might not find it. But again, there are just different ways you can do it. And it's nice that they have these little drop-down menus that you can use. And you could definitely work with it and play with it and see where it goes as you look at it. All right. And then the third and final one is our community guide. And I will do commas here, where we're just going to type in those 3 terms again that we did with PubMed. Right. I did. Lost my thing. All right, let's go back over to my. All right. As we go along here, we will do a search. And we get, in this ideal, 35 results, right? So what we want to do. Now, again, if we're really looking for the highest level ideas here, we're going to hit systematic reviews, right? And we get 3. You know, and since we were more interested, at least in the last one, of cervical cancer, we can find a systematic review on cervical cancer. It's published, what was found. This is specifically for communities that we look at. And again, it really did it. I mean, it gives you what's systematic review. It gives you a summary of results in very plain language. It's a good little tool you can use specifically as you want to look through it. And like I say, what's nice is it will also say, hey, if you're not just interested in cervical cancer, you can also look at breast cancer or colorectal cancer as well. There are studies that have been done on this as well. So again, these are really the three demos we have here. I'm happy to answer questions, do another question or answer it there as you see here. But really, this is what it is. And the other nice thing is we have supporting materials too, which is nice. It has the logic model that they used and the text description that you can download as you go along. So I'll give you a minute here to ask any questions or comments on that, or see where you're at. I'll stop sharing my screen. All right, so we got some resources out there. They are good. So I will go back to presentation here. Bear with me here as I do a share here. It'll take me a second to get back to where I want to go. Where we are. So those were our demos as we look at it and we do it, and we can definitely use those. There are other resources too. These are the three we like to cover today. So there's a couple more resources. Like I say, you can use the Campbell collaboration, which is a good tool that you can look at. It's International Social Science Research Network that provides high quality, open, policy relevant evidence syntheses, plain language summaries, and policy briefs. Does not have too many specific specific examples, but may offer additional context when working with other departments and disciplines to develop programs. And then another one is our county health rankings, which is a good way to really look at what's going on specifically in our counties, what we're doing, how we're working, where we're trying to go, and look at where we're looking at to see what we can do to move things forward. Like I say, it has a section on interventions and policies that has promise organized similar to the community guide. And I could talk about two more. I don't have the pictures for them, but there's the TRIP database, which you can actually type in PICO questions and get results. And if you do have access through your institution, the Cochrane Library offers for at least Cochrane systematic reviews. You can also type in the PICNO pieces in there and find more resources there to really answer your PICO questions as you go along. Those are a couple of more resources that are definitely available, and specifically if you want to use PICO searching for your idea. And then I have a question here. So these three demos are great framework for surveillance, which can be used to identify emerging health problems. What steps are essential to ensure the data is applied effectively in preventative? And that's where you're going to have to take that data and justify it. That's where you as the expert, you as the content specialist are going to have to come back and say, hey, I need to do these things. I need to make sure that it's being used appropriately, because again, data is the data is the data. How it's used is one other question. How we're going to do it, how we're going to justify it and use it, and in the wrong hands, it can be a problem. The next one we have is, how can academic health science librarians best support public health degree programs? From my perspective, the best way to support is just be available for them. And maybe, again, the other thing is to be familiar with systematic reviews and systematic approaches to getting to doing these type of reviews, because a lot of students anymore are told that they need to find to create an evidence-based intervention or design an evidence-based intervention. Well, that means that they're going to have to find systematic reviews. And usually when they're doing their literature search, if they are thinking about it from the PRISMA perspective or from another systematic review perspective, it will help them find those resources, move those resources forward, and really be able to maybe even have themselves work with a professor or another librarian to actually develop a systematic review on their findings so that they can create their own evidence moving forward. From your experience, is there much overlap between the sources and index within PubMed I would say there's similarities, but there's difference. You got to realize each one is going to have a slightly different stint, has different inclusionary and exclusionary criterias that are there. So I would say, I mean, again, I'm always going to say go back to our primary product, which is PubMed, because that's our product. I'm going to be biased. I work for the National Library of Medicine. So I'm going to say that our product is probably going to be a little more inclusive because of the way it is. And I will say this, more journals and scientific publishers pay to index in PubMed than any other out there. So again, there's going to be more complete, but that doesn't mean you shouldn't use those other things, because it may be that you want to see somebody's further analysis, because like I say, in the community guide, they've done the analysis for you a little bit to say. Now, that doesn't necessarily mean you agree or disagree with what they've said. At least they're at least looking at it from a public health. Well, they don't necessarily pay directly. It's called indexing and abstracting. And I won't get into that, but there is an index. When you're indexed, you choose the areas you want to be indexed in. And part of that is indexing to PubMed. And there is usually a nominal fee for that. Other questions? All right. Yeah, do not pay. Yeah. And I'll also say that some publishers, what they will do, depending on the journal, will charge for, they shouldn't do it, but they do charge people to be indexed and abstract. So as depending what side of the publishing world you work on. Teaching these skills to undergrad public health majors. I would say, you know, a lot of it is just getting them familiar with, you know, what evidence-based means. Letting them understand where to find the idea, what the difference between peer-reviewed journal articles versus non-peer-reviewed. Really focusing on your cores of information literacy is what I would say. And really also focusing on, you know, understanding what search terms are, keywords, mesh terms. Those are the ones I would focus on personally if I was teaching that group of students. So before I go on and before we run out of time here, I'm going to give a quick recap here. As evidence-based public health utilizes the three domains of influence, which we talked about. Evidence-based public health follows a 7-step process. And we can use pubmed.gov, healthevidence.org, and the community guide to help find quality research. I'm also here. We can have some more questions, comments as we go along. As we do it, you have your evaluation there. And there are always more training opportunities there. And you can sign up for our class email that goes out once a week, that what new classes are coming up and other classes that we'll do as we look at it as we go along. So I'm here for a few more minutes. If you want to do, I'll stop sharing my screen so we can see people and I can watch the chat a little more closely.
Hi, David. We had one
Yeah.
more question that came in privately.
Okay.
It's a whammy.
Okay.
It's what is your opinion on the use of AI? I'm trying to scroll through the chat and I find the
Okay.
verbatim, but if you'd like to
Okay. Well, I will
riff
say,
on that.
yeah, I can riff on it a little bit. So, you know, artificial intelligence has a lot of opportunity here because it can find the stuff. We can set up a machine learning algorithm to find these articles for us, right? We can do that. The problem is how much power do we give that AI and are we validating it? The trick here is we can use the tool, but we shouldn't let the tool replace the human. And in that case, it's, yeah, let's use the tools. Let's let it search. Let it web crawl all the resources out there. Let it do some of your searches for you. That's fine. But also realize it might not catch everything. It may generate fake things. So you as the researcher need to go back and validate or ensure or enhance as you best find when you do it. So that would be my opinion on it. It's not perfect. And again, you always have to look at who really owns that AI. I mean, like I say, I would try to find a more independent one than maybe ChatGPT or others that are out there. But again, that's just what I would say is we can use it. It's a tool. And again, I'm a fan of it to a degree, but I'm also reticent, and I would say you have to do it. Any other questions? Or are we?
I think that's it. There was one more question just asking about when did the community health worker come into being? Was it recently? Is it a recent field? Is
It's
it
not necessarily a super recent field. Community health workers have been around for years. We might not have called them in that capacity as that term of community health workers. The profession really sort of took off in the late 90s, is when we started seeing more of them. Late 90s, early 2000s is when it became a little bit more out there and popularized that as a term. Because like I say, the practice of community health hasn't been anything. It used to be, public health nursing, community health nursing. It was all part of that. And then we started giving training, we started getting certifications and all, and there was a big move and push to make it a more recognized profession. So it's, I would say late 90s, 2000s when we started really seeing that push move forward.
great? Thank you.
Mhm.
I think that is all the questions that we've had today.
All right.
We can hang out for a little bit longer.
Yeah.
Thank you
And
everyone for
if
attending, and thank you for a wonderful presentation, David, as always.
no problem. And if anybody, feel free to leave. Enjoy the last 4 minutes of your hour before you go on to your next meetings.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.